So hello and welcome. This slide is about the health effects of high altitude by Dr. Ignacio Skoll. The high altitude means in the Himalayas the altitude is high and it causes various effects. So physiological effects at high altitude are quite significant. On Mount Everest, barometric pressure, that is the atmospheric pressure, falls by 50% at base camp, that is 5,400 meters, and by 70% at the summit, that is 8,848 meters. The physiological effects of high altitude are there is a reduction in oxygen tension, which results in a fall in arterial oxygen saturation, that is SpO2. Acclimatization to hypoxemia at high altitude depends on the shift in the oxygen hemoglobin dissociation curve. So the shift in the oxygen hemoglobin dissociation curve depends on 2,3-DPG, the erythropoiesis, hemoconcentration, and hyperventilation from hypoxic drive. So the high altitude related illness can occur above 2,500 meters. It is common above 3,500 meters. And 50% of people who ascend above 3,000 meters suffer from high altitude sickness. So our first basic one is acute mountain sickness, AMS. So when you're ascending above 2,500 meters, you will develop symptoms like headache, fatigue, anorexia, nausea and vomiting. You'll have difficulty sleeping, you feel dizzy. There is ataxia and peripheral edema. Symptoms occur within 6 to 12 hours of ascent, and the symptoms of acute mountain sickness can be quite trivial to incapacitating. So, how do we treat acute mountain sickness? Rest, analgesia. The symptom usually resolve after 1 to 3 days at stable altitude, so you should stay where you are for 1 to 3 days or descent. You should not ascend because with ascent the AMS may recur again. So after 1 to 3 days you can ascend safely. This AMS can progress occasionally to cerebral edema. Acetazolamide is treatment, and I've highlighted it red because it's very important treatment, and it is also prophylactic. If a rapid ascent is planned, you can actually start acetazolamide 2 to 3 days ago. For treatment, it is actually doses 500 mg 3 times a day, but for prophylactic you can use once daily dose of 500 mg acetazolamide. So another one is high altitude cerebral edema. So the cardinal symptoms of high altitude cerebral edema are ataxia, which means loss of balance and altered consciousness. It is life-threatening, and the symptoms can be confusion, disorientation, visual disturbance, lethargy, and loss of consciousness. There is also papilledema, retinal hemorrhages, and focal neurological signs. So what are the treatment of HACE? That is, one is you improve oxygenation. Descent is actually essential. And dexamethasone, which is a long-acting corticosteroid, 4 mg 4 times a day can be given. And oxygen therapy in a portable pressurized bag. So in case of AMS, you can stay at the same altitude for 1 to 3 days, and the AMS will go away. You will acclimatize. But if HACE, high altitude cerebral edema, develops, descent is actually essential. So another entity is high altitude pulmonary edema, HAPE, which is also a life-threatening condition. It occurs in the first 4 days after ascent above 2,500 meters. It may occur de novo without acute mountain sickness. Dry cough, exertional dyspnea, and extreme fatigue are common symptoms. Later, the dry cough becomes wet and the sputum may become blood stained. Tachycardia and tachypnea at rest can occur. And crepitations may be heard in both the lung fields. The SpO2 is reduced. It is not diagnostic, but it is a marker of a disease progression. A treatment of HAPE, you should first reverse hypoxia by giving oxygen, and immediate descent is very necessary, and nifedipine 20 mg 4 times a day as the treatment. Thank you. Subscribe to Ignacio Skoll for future videos about medicine.